Hi. So why would somebody order a tilt test on you? Most of the time when we're talking about cases of possible dysautonomia or known dysautonomia, this test is ordered in order to provide evidence, scientific evidence, that you have an abnormality in the way that your autonomic nervous system compensates for position changes, especially upon standing, so that you don't pass out, period. The problems with this test are many, and you should know that the tilt table test is an area of controversy, period. That being said, I'll tell you why it's a possible area of controversy, and I will also tell you why it is ordered anyway. Okay, in order to understand this, I'm sorry, but we need to go back into mathematics, and specifically we need to go into statistics and epidemiology of a disease, and we have to talk about something called true positives and true negatives. A true positive is called the sensitivity of a test. How sensitive is this test? If 100 people all had dysautonomia and all faint from it, then 100 people that do the TTT should all pass out, making the test 100% sensitive to detect dysautonomia when it exists. So that would be a true positive. Unfortunately, not everybody faints, and so this test comes with a lower sensitivity than science would like to have. It's not the perfect test by any means, and it probably needs to be perfected. And so some of you great engineers and physiotherapists and physiologists and EPS doctors can try to beef up this one and get yourself a piece of new equipment and a patent on something that hopefully has a higher sensitivity. So sensitivity has to do with true positives. The test is positive and you do have dysautonomia, and the test was done and it caught, so to speak, the dysautonomia. So number one, the sensitivity for the tilt table test is lower than it should be because it's not a perfect test. Number two, true negatives have to do with the specificity of the test. Okay? If you have the test done and you get a negative result, i.e. such things as, say, for simplicity's sake, you did not pass out, what are the chances on the specificity of this test that is a true negative? Okay? Because some people will have a negative tilt table test and not pass out, but still have dysautonomia and still have it just be undetected that particular day. As you know, we have good days and we have bad days. So just because you get a negative tilt table test does not mean that you do not have dysautonomia, because this test not only has a lower than desired sensitivity, it also has a lower than desired specificity. In other words, it may miss some people that really do have the test and therefore not be reflective if the result is negative. So the doctors really categorize this in specific ways, and then use that with their clinical judgment and with your clinical history, with your list of medications, with your different things, and they tie that all in together. So the worst case scenario is you really feel awful, you faint all the time, you go in, you get stripped off, your clothes, and you get Velcroed on like Herman the Munster. You go through all this stuff and you feel like absolute terrible. You feel absolutely like you've been through a train accident by the end of this. And then you feel that they tell you that the test is negative and you're not sure. You're like, what? I faint all the time, or I passed out, I can't even take a shower, and why is this test coming out negative? Now everybody's going to keep thinking what they already do, that I'm making it up, and now this test is going to hurt me instead of helping me. That is not true, okay? Because this test has a lower than desired specificity, so you can be truly positive and have this test not pick it up, okay? So that's one of the big areas of controversy. That could be why many doctors have never heard of the tilt table test, could be why many of the doctors don't use the tilt table test, could be why many doctors don't believe in the tilt table test, and it could be that we simply need something better than the tilt table test. Right idea, but more expansion of knowledge and more specific things to do to draw out a positive result. Okay, none of us really wants to faint, and I will tell you that if you faint during this test, you will feel awful. But they will have the team there. They'll have a bunch of doctors available. They're set up and ready for a code. They're set up and ready if you vomit. They're set up and ready, for any kind of adverse reaction that you may have. So going into it, I want you to be informed and visualize what's going to happen to you, because nobody told me what it was going to be like until I went into it. And number two, I also want you, when you wake up from this tilt table test, to understand and have some confidence that, especially that if you did not pass out, it doesn't mean you don't have dysautonomia. Okay? My ideas completely different than probably anybody else, or probably similar to some people. EEG, for example, the electroencephalogram that's used to test for seizure activity, some people have to do that. That test has a sensitivity that's not that great, so you can still have seizures and that test won't pick up on it. And the specificity, the true negatives are lower than it should be also. So what they do with an EEG, they may do sleep deprivation, they may do other things in order to make your body more tired and more sick, so to speak, so that the EEG will pick up on a seizure focus that's in your brain. So for the tilt table test, we do have good days and bad days. I don't know. I doubt if it's been studied, but somebody could do a video reply and tell us if it's been studied. Do we know what to do with this test once it's negative? And so don't lose heart if it's negative. Everything will be okay. Mine was negative the first time. I felt really sick. I was going to vomit. I did not vomit, although they had the bucket, the little vomit tray right up in my face. And the second time I went back, it was positive. I don't know what was different with my body between the 2 days, but just understand, if you go into this, it's a little bit weird, it's a little bit barbaric, and you may have a negative test, but that doesn't mean that you're going crazy. It doesn't mean that nobody's going to believe you. Everybody that uses this test knows that it's not the perfect test. And that's perhaps why it's not as widely used as it perhaps could be. And any of you great geniuses out there, you can figure out a better way to make this thing work so that it's more sensitive and more specific, and that will help all of us. Take care, and I hope this helps. Bye.